Upper arm, elbow, and forearm chronic and overuse conditions. Chronic and overuse conditions include olecranon bursitis and epicondylitis, including medial epicondylitis, usually termed golfer's elbow, and lateral epicondylitis, more commonly termed tennis elbow.
Olecranon bursitis is a condition characterized by pain, redness, and swelling around the olecranon process. This is caused by inflammation of the elbow's bursa. This bursa is located just over the posterior aspect of the proximal end of the ulna. In common with other bursa, it is impalpable and contains a very small amount of fluid in its normal state, and fulfills the function of facilitating a joint's movement by enabling anatomical structures to glide more easily over each other. Symptoms include swelling in the elbow, which can sometimes be large enough to restrict motion. There is a pain originating in the elbow joint from mild to severe, which can spread to the rest of the arm. If the bursa is infected, there will also be prominent redness and the skin will feel very warm. Another symptom would include the infected bursa would possibly be a spontaneous opening or drainage of pus. Conservative management of minor cases involves icing, a firm compression bandage, and avoidance of aggravating activity. This can also be augmented by oral or topical anti-inflammatory medications such as NSAIDs. Elbow padding can also be used for symptomatic relief. Treatment for more severe cases may include the aspiration of the excessive bursa fluid with a syringe or draining the bursa, or injecting the bursa with a type of medication which is aimed at relieving the inflammation and preventing further fluid accumulation. Overhand throwing places extremely high stresses on the elbow. In baseball pitchers and other throwing athletes, these high stresses are repeated many times and can lead to serious overuse injury. Unlike acute injury that results from a fall or collision with another player, an overuse injury occurs gradually over time. In many cases, overuse injuries develop when an athlete's movement is repetitive, often during a single period of play, and within these periods of play, games or practices are so frequent that the body does not have enough time to rest and heal. The ulnar collateral ligament is the most commonly injured ligament in throwers. Injuries of the UCL can range from minor damage and inflammation to complete tear of the ligament. Athletes will have pain on the inside of the elbow and frequently notice decreased throwing velocity. Although throwing injuries in the elbow are most commonly occurring in pitchers, they can also be seen in any other athlete who participates in repetitive overhand throwing. Epicondylitis occurs as a result of inflammation at the medial or lateral epicondyle of the elbow. The medial and lateral epicondyle serve as major muscle attachment sites. Repetitive contraction of these muscles can cause constant irritation of the epicondyle, resulting in epicondylitis. The common flexor tendon originates off of the medial epicondyle and commonly results in medial epicondylitis. Medial epicondylitis is commonly known as golfer's elbow. This does not mean that only golfers have this condition, but the golf swing is a common cause of medial epicondylitis. Many other repetitive activities can also lead to golfer's elbow. Throwing, chopping wood with an axe, running a chainsaw, or using many types of hand tools can contribute to medial epicondylitis. Any activities that stress the same forearm muscles can cause the symptoms of golfer's elbow. Overuse of the muscles and tendons of the forearm and elbow are the most common reason people develop golfer's elbow. Repeating the same types of activities over and over again can put too much strain on the elbow tendons. These activities are not necessarily high-level sports competition. Shoveling, gardening, and hammering nails can all cause pain of the golfer's elbow. Swimmers who try to pick up speed by powering their arms through the water can also strain the flexor tendon at the elbow. The main symptom of golfer's elbow is tenderness, pain at the medial epicondyle of the elbow. Pain usually starts at the medial epicondyle and may spread down to the forearms. Bending your wrist into a flexed state, twisting your forearm, or grasping objects can make the pain worse. You may feel less strength when grasping items or squeezing your hand into a fist. Treatment for medial epicondylitis includes price, NSAIDs, stretching, and possibly the use of an elbow strap, which will change the line of pull of the tendon and thus can help reduce pain. Tennis elbow occurs at the lateral side of the elbow and is more common than medial epicondylitis. Tennis elbow is a type of tendonitis or swelling of the tendons that causes pain in the elbow and arm. These tendons are bands of tough tissue that connect the muscles of your lower arm to the bone. Despite its name, you can still get tennis elbow even if you've never been near a tennis court. Instead, any repetitive gripping activity, especially if they use the thumb and first two fingers, may contribute to tennis elbow. Tennis elbow is the most common reason that people see their doctors for elbow pain. It can pop up in people of any age, but is most commonly seen in people around the age of 40. Tennis elbow usually develops over a period of time. Repetitive motions, like gripping a racket during a swing, can strain the muscles and put too much stress on the tendons. That constant tugging can eventually cause microscopic tears in the tissue. Tennis elbow might result from tennis, racquetball, squash, fencing, weightlifting. It can also affect people with jobs or hobbies that require repetitive forearm movements and gripping, such as carpentry, typing, painting, raking, and knitting. The symptoms of tennis elbow include pain and tenderness on the bony knob or outside of your elbow. This knob is where the injured tendons connect to the bone. The pain may also radiate into the upper or lower arm. Although the damage is in the elbow, you're likely to hurt when doing things with your hands. Treatment of lateral epicondylitis includes price, NSAIDs, stretching, and the use of an elbow strap, which again changes the line of pull of the tendon and thus can help reduce pain.